I grew up with my half-brother, Hassie, who had been lobotomized in the early 50s before the psychotropic drugs were around. And he was very, very sick, paranoid schizophrenic. My husband, the pastor, Mark Meeks, and I started a halfway house for young adults mostly to help them not go into the state hospital, or as they were coming out, to help them stabilize. When one of our residents would move from one apartment to another, which happens a lot with mentally ill people, then he might lose all of his connections with his therapist, his records would get lost, he would be disoriented, etc. So we needed an integrated system. We had an election coming up for mayors, and I asked Jean Demler, a researcher, to put together a briefing about the need for reform for the chronically mentally ill. I got a phone call from someone whose name I couldn't pronounce. His name was Federico Peña, and he said, you know, boy, this is a great briefing paper. I wish we had these kinds, you know, for every forum we had. And lo and behold, even though he had a funny name, he was elected the mayor.
Well, back in the 1980s, when I was first elected mayor, we had a very dysfunctional mental health system. There were different organizations in different parts of the city. People were falling through the cracks. If somebody moved from one part of the city to the other, they wouldn't be able to get continuity of service. And on top of that, we had an increasing unemployment rate. There were a lot of people who were homeless. And so we had a dysfunctional system that really wasn't providing services to people who needed them.
With the support of the mayor, there was the support of the entire city administration, and that was key, because we couldn't have done the reforms without the support of the mayor's cabinet. It's not just enough to get people working together. You have to formalize a new structure, and that was the Mental Health Commission.
By putting together the commission, we came up with a comprehensive plan for the entire city. We found a way to encourage all the organizations to come under one umbrella that made all the services more efficient. They started raising money, but more importantly, the quality of the services improved.
Sometimes I think if only the Mental Health Center of Denver had existed when my brother needed it most.
The extraordinary accomplishment of this organization is that it has become one of the finest in the United States. People now come here and look at this model, and the result of it is that we're now healing people.
I see this as sacred work, and it is such a privilege to have been part of the creation of this integrated system.